Dear students, we'll discuss a case scenario which is not that common but quite interesting. We don't get to see that condition very commonly, not very commonly, but it's very interesting. That's why I'm discussing and putting this slide. And also, but it is will be asked as a short note in the theory exam. One of the common theory exam questions, short note. Even though clinical case we won't be able to see on day-to-day regular basis. It's an uncommon entity. So just see this one. What is this condition is? Look at that. Tortuous veins are there. Tortuous vessels are there. If you look at the, you have to always look at the, explain this one and look at the side also. Look at all around. Then and palpation, look for the tenderness, locus of temperature, warmness. Warmness is important, especially in vascular malformations. Then pulsatile is important. So that will say that this is what exactly it. So this is nothing other than Cirsoid aneurysm. All of you heard about it, but might not have seen a case because it is not that common. It is mainly occurs in the lateral area, sometimes in front area. In front area it has happened. Commonly in the branches of the superficial temporal artery in this area. It's common in the scalp, and important thing is it's pulsatile, very vascular, and often extends extensively and may erode into the bone and have a intracranial extension. It may bleed also, so either intracranial outside also. Thrill will be felt on palpation, and continuous murmur will be heard on auscultation. So bruit will be heard. So auscultation also over this area using a stethoscope is important. Palpation for thrill, pulsatility, it's very typical. And bone erosion you have to look for always. Erosion is very common because all these vascular anomalies has got tendency to erode the bone underneath. It's a very common feature, which is also important. It can be congenital or traumatic. I said it's as such uncommon. So this differentiation often will have a different guidelines to differentiate. I'm not going to discuss that. What is important thing MCQ they will ask is commonest artery which is involved is superficial temporal artery. This will be asked as a MCQ question which you have to remember. Bone erosion should be checked, for which is common warmness, pulsatility, thrill, bruit already discussed. Now important thing is pulsating bag of worms with the thinning of the bone is typical. That's very, very important point. Intracranial extension, CT angiogram, and treatment is ligation of the superficial temporal artery with the embolization. Sometimes this is the small one actually. Look at this, but sometimes entire area will be involved. It is very, very distressing to the patient. That's why this condition is important. Very often as a short note MCQ they will ask. Oxy they will keep as a word this one rather than a case, because case is not that common to get in day-to-day surgical OP. But oxy will keep as a note and explain what is it. So that is also as far as exam is considered, it is important. So answer the MCQ, student. Klippel-Tremontier-Weber syndrome is A, B, C, D. You can go through it. So put it in the comment box, right answer. I will give you the answer later with a proper explanation. I also acknowledge your answer definitely. And please go through my SRB's manual of surgery and SRB clinical methods of surgery, where you can know how to examine this vascular malformation, because this is a typical Cirsoid. It's one of the type of vascular malformation. There are different types are there: hemangioma, capillary hemangioma, cavernous hemangioma. So everything is there in detail in that. And manual of surgery, again, vascular lesions or topic is there. In that again, Cirsoid and then treatment, management, in everything is there, features in detail. You can always go through that as a further reading in my SRB's manual of surgery and SRB's clinical methods of surgery, so that I will have a detailed idea about different vascular lesions and vascular malformations. So give the correct right answer. Again, answer this MCQ. What the likely clinical diagnosis of lip lesion, disc lesion? So A, B, C, D. Give a right answer, and I'll acknowledge you and appreciate your answer and your explanation. And I again request all of you go through my subscribe my SRB's Surgical Insight website in the YouTube and other channels. Please subscribe, and also go through my manual of surgery book and my clinical method in surgery, because all these things are given in detail with the proper illustrations and photos. So you'll be able to answer these MCQs or different MCQs, whatever asked in the eventually your NEET exam or in regular day-to-day basis exams also. All most of the NEET questions, answers, MC questions, answers are there in my book and clinical methods. You can always go through it. Quotation of the day, students. Staying positive does not mean that things will turn okay. Rather, it means you will be okay no matter how things turn out. So there's a good quotation for your future development of your career. So please appreciate. And so students, please go through my SRB's clinical methods in surgery current edition, which gives in detail about the clinical exams, all chapters including x-rays, other images, basic instruments, specimens, and gives a very lot of photographs are there, figures, illustrations are there for your benefit. Detailed clinical methods and case sheet rating is there. That's very important for clinical surgery. And manual of surgery current edition gives a detailed discussion of all topics, specialties, urology, cardiothoracic, and other chapters, including instruments, operative surgery specimens, as per CBMA syllabus in detail for your knowledge, exam, theory, clinicals, everything. Please go through that. And of course, my operative surgery book with the 2 volumes is very useful to understand the every operative procedures, the step-by-step technique. And my atlas of tissue approximation, small book with a video. All this contains a video of demonstrations of different things. It also gives a suturing technique very briefly, very nicely, and with the principles. Please kindly go through that. And my SRB surgery insights and YouTube different channels, my website. You can please subscribe. That will give a lot of information, and it will be very well benefit for all students. And please subscribe my SRB surgery insights of different modalities for understanding better knowledges and subjects, because different topic, different versions are there in small topics in the website, and this is the QR code for the same. So students, I hope you understood the Cirsoid aneurysm topic very well. Thank you very much.